really have experience as a caregiver for people with epilepsy, except for a few times when I have been the witness as opposed to the person having the seizure, in which I've had to remember the first aid tips that I would give out. Don't move the person unless it's absolutely necessary. Like, they're in water, for example, drowning risk, if there's anything sharp or anything electrical nearby that can shock them, just in general. Don't stick anything in the mouth. You have to understand that things will run their course, and during a tonic-clonic seizure, if anything's in the body from pee to vomit, it will probably come out. Law of physics, what goes in must come out. And afterwards, turn the person over on their side. This is called the recovery position. I don't really have that much experience, though, as the caregiver, but I do have experience as a patient, and I could write horror stories about my medications. One of my least favorites, and one that also caused a massive rash, was Keppra. But it started out with a really bad headache, and a personality that, let's be honest, it was called Hulk in a bottle here. Everything but the green skin and purple pants. I told an entire grocery store that I hated cucumbers, and that's one of my favorite foods. I was just angry and close to an episode, and I was hurting, and at that point in time I probably would have disagreed with everyone on everything. Now, mind you, people with disabilities are human, and sometimes I'm just a stubborn asshat, or really incapable of having a kind and decent conversation, especially when first woken up. I am not a morning person, and I have been known to be a bit of a clumsy crankopotamus. Oh yeah. So basically, just remember that, one, we're all human, and that there are people with epilepsy who also possess rather difficult personalities on top of this, which can come in, and that certain medications like Keppra are known to bring on just anger and fury and just sometimes just plain meanness. So watch yourselves. Do stand up for yourselves if someone is being aggressive or hurts you. Do find a respite program just in case. Make sure that you discuss any and all of this with that person's doctor, and any other caregivers. For example, if they have a home health aide, discuss it with them. And if the dose is too high, because during the beginning months or when you're on a medication, they will be jiggering the dosage, it can be very tough, and the brain will react accordingly, and you might not act correctly in public. But patients deserve love, and caregivers deserve love. Don't let yourself be gotten at, and just remember that, yes, sometimes the illness and the pain and the medications can cause you to behave a bit like a jerk. However, sometimes people are just jerks, because we are still capable of thinking and making decisions, and sometimes having that. And sometimes people also go through a period of self-pity, especially at the beginning. Why am I like this? Oh, everything's terrible, my life is over. And of course that helps aid. So of course I would also suggest, at least for the first little part, maybe also besides your neurologist, I would also recommend, you have your medical doctor, you have your general, you have your neurologist, You have most likely a few nurses. You may have a home health aide, and I would highly suggest going to see a counselor both for yourself and that person, because mental illness goes along with epilepsy a lot. So it's something called a codependency or a comorbidity. And if a medication seems to be affecting someone in such a way, for example, a rash, or they're in more pain, or something just feels off, definitely discuss this. Don't stop anything willy-nilly, but definitely discuss it with all your medical practitioners. Also, and caregivers, you should not be alone. You need to also have someone to help you. Do not just go it alone and be all like, oh yeah, everything's fine, yada yada. I know for children, they have respite programs for parents of children with disabilities, because it can get tough. And sometimes people need a break, so they go and they visit other people. And you get, get a couple of days in a nice hotel and, take a breather. I don't know what they have for adults, and I think it would probably depend on how the person is affected and other external factors, but make sure that you have someone on call, sort of standby. And definitely, a home health aide is definitely helpful. Like I said, do not go it alone. And just know that your patient can be a big jerk just because. It isn't always to do with the medication. Here's a secret for you. Sometimes you can be a big jerk and have an illness all at once. But sometimes, so if you're on a medication that continually makes you very, very ill, and or your mood and your socialization is off, talk to your doctor and any other professionals, because something might seem slightly fuggy. And I highly recommend making sure that everything is looked at. And because, it's nerve-wracking. So make sure that you have that capacity to talk, and don't be afraid to enjoy things sometimes. And yes, there will be times when something will come out of their mouths that comes at you from left field. And I think this is the problem this is something I've noticed with chronic illnesses. Sometimes things that you just don't expect. And it can be painful, and you can feel really, really horrified, but take a breather. And arguments will happen, fights will happen, frustration will happen, and that does not make you a bad person. If you feel like you are in danger, or you feel like they are in danger, or you are overwhelmed, please make sure that you're safe. Go get yourself a coffee or whatever. Take a nap, whatever, until you can be calm enough, and above all, love yourself. Take good care, and thanks so much for all that